Welcome, everyone, to the Legal Levers for Health Equity in Housing webinar series. Today's webinar, Creating Equitable, Diverse Neighborhoods and Communities, is the first in a three-part series co-hosted by the National Center for Healthy Housing, the National Low-Income Housing Coalition, and our colleagues at the Center for Public Health Law Research at Temple University, whose recent work inspired this webinar series, which is going to really focus on exploring the goal of health equity in housing through the lens of laws, policies, and other legal mechanisms to understand how those levers can support broad-reaching systems change to help us establish access to safe and affordable housing in richly diverse and supportive neighborhoods. Before we dive in, let me remind you that everyone and all participants are in listen-only mode, but that doesn't mean that we don't want to hear from you. We absolutely want to hear from you. This is an important conversation. So we ask you and invite you to enter any comments or questions you might have as they occur to you throughout today's presentation into either the chat or question and answer boxes that are likely on the right-hand side of your screen. And we promise we'll get to as many of them as we can during the discussion time at the end of today's webinar. You can enter those questions at any time during today's discussion and presentation. We'll also be recording today's webinar, and we'll share the link with everyone who has registered, as well as recording all of the other webinars in this series. So why housing? Housing is, as I think many of you signing on today probably know, one of the most well-documented social determinants of health, affecting residents through multiple pathways. You see here on the screen a diagram that the Robert Wood Johnson Foundation has used to capture some of those different pathways. And as such, it's also a really powerful platform for transforming and supporting resident health and well-being. As we know, for most Americans, homes can provide security and shelter, but homes that are unaffordable, that are located in areas that have environmental hazards or that lack basic services, or that are poorly constructed or maintained, can significantly impact the health and safety of residents. Many of us on the line today have understood these connections for a long time, but the importance of housing has become even more apparent over the last few months as we've been asking people to spend more time at home and telling them that they're safer there. And while we all agree that social distancing and sheltering in place are critical public health measures to combat the ongoing global pandemic, the reality is that being at home might make you safer from COVID-19, but not all families are able to be safe at home. Some families are facing eviction or housing instability, others, and exacerbated by the global pandemic. Others are sheltering in place and spending close to 100% of their time in unsafe environments that may contain lead or asthma triggers or other hazards. And I know here that NCHH, we've been reflecting a lot in recent months about how much of the work that we do is necessary because of a long history of disparities and racist housing policy. And that is why the type of approach that we're going to be highlighting today that really centers equity and racial justice is so essential and so timely. If you're tuning in today, we probably don't need to convince you that we have a housing crisis in this country and that much more needs to be done to make homes safe, healthy, and affordable, especially among low-income families. But I hope you're also going to leave this webinar and the other webinars in the series feeling inspired that housing doesn't just have to be this big, overwhelming problem. It's also one of the most powerful solutions available to help us solve some of our most pressing societal problems. And how that equity lens that we'll be talking about throughout the webinar series can really be the key to helping us work with communities to solve multiple problems. During today's webinar, Creating Equitable, Diverse Neighborhoods and Communities, the first webinar, as I mentioned in our three-part series, we're going to hear from presenters from Temple University Center for Public Health Law Research, the Oak Park Regional Housing Center, and the Inclusive Communities Project, who will define the concept of health equity in housing, particularly as it relates to communities that are equitable and diverse. They'll also examine strategies to achieve this goal, and we're going to be talking about a lot of different aspects of this issue today. I'll briefly introduce each of the presenters as we go, but you should know that all of our presenters are incredibly accomplished, and I'd take up our whole time together today if I tried to list all of their accomplishments. So I encourage you to read more about them and their organizations online. To help us get started today, though, I'm pleased to introduce Scott Burris, who is a professor of law and public health at Temple University, where he directs the Center for Public Health Law Research. His work focuses on how law influences public health and what interventions can make laws and law enforcement practices healthier in their effects. And he'll be helping us kick off our webinar series by defining what we mean by health equity in housing. Scott?
Thank you very much for that that great introduction. And I want to thank everybody for listening, and thank my co-presenters, not only for what they're going to be telling you today, but also for the help that they and their organizations have given us in doing the legal levers for health equity in housing. And I think to thank them for the incredible work they do to make housing more accessible and safe for people in their communities. So I also, of course, want to thank the Robert Wood Johnson Foundation and the Policies for Action program that funded the work that my team did on this project over the last several years. We've already seen the crisis and solution slide, and the crisis slide, I think, is made up of these elements. Somehow or other, in spite of lots of law, in spite of lots of promises, and in spite of lots of really inspired and hard work, our housing system has not produced what we wanted it to produce. We have this chronic affordability gap where there's just not enough housing that people can afford, whether the rent is too high or the paycheck is too low. The gap between what people can reasonably afford to pay and what's available on the market is stunningly big, and if anything, growing. We have had more than 50 years of a public, dramatic national commitment in the law, in the Fair Housing Act, to fair housing, defined it largely in terms of getting rid of the legacies of redlining and de jure segregation in America, and yet we're still a heavily segregated society. And when people do get into a home, a lot of people at the lower end of the income spectrum are living in houses that are not healthy. A lot of people talk about the success we've had with lead, and yet we still have 4 million households where children are exposed to high levels of lead. And we still have several 100,000 children a year who show up in emergency rooms with serious damage because of their lead exposure. This is a funny time where I don't have to tell you, all of us are probably on lots of webinars and don't have that much communication with each other. We have a lot of time to think about life as we stare at our screens. And a lot of things are going wrong. And there's a lot of things to be mad about, but there's also this sort of, for me at least, a sense of opportunity and maybe excitement in the fact that people going through this experience, this national experience, seem to be changing, seem to be thinking. Things that I guess we used to think we could live with, or that maybe small incremental action could address, people are starting to say, no, that's not enough. How is it that this country has gotten to be where it is? A lot of people are looking around and saying, this isn't the America I thought I lived in, or they're saying, this isn't the America that I used to live in, or maybe like James Baldwin, they're saying it's never yet managed to be the America it should be. But however you think about it, maybe we're in a time when people are ready to realize that we need change that's as radical as problems we're facing are severe. And no problem captures that more clearly than housing. Over the last 50 years at least, we have essentially made policy decisions that have taken a bad situation and instead of improving it have made it worse. And only serious changes and radical changes in policy, I think, are going to turn us around from that. That's what our project about legal levers for health equity in housing was about pursuing. We're not housing people on our team. Well, some people on our team. Katie Moran McCabe, my colleague, has got a lot of housing experience, but I'm a health law person. And so I came at this from the point of view of asking, what do we know about how law can influence the environment and influence behavior of individuals and organizations in a healthier way? And what do we know about how law is maybe doing bad things? Because sometimes law is not helpful. It's part of the problem. And we focused that question on the issue of housing. And so one of the first things we did, and this is just a screenshot of the table of contents and a title page of an article, in which we tried to understand how have a variety of different kinds of law that are supposed to be about moving us towards better housing conditions, have they actually done what they're supposed to do? Starting with the Fair Housing Act, which, in many ways, clearly has not resulted in the end of segregation after 50 years. So we looked at 20 or 30 laws or legal levers that are used in housing, and found that most of them, either we had no evidence that they were working, or we actually had evidence that they weren't working. And that's a problem, because in our politics, politicians certainly, and I think a lot of people in the public, tend to think of the passage of a law as sort of a success and as a solution. You know, if we've passed a Fair Housing Act, that should mean that we've sort of taken care of our obligations in the realm of fair housing. But as you know, people on this call know, and as my colleagues will tell you from their own bitter experience, it's not the law in the books that matters, it's what you do on the streets. It's whether the law is turned into change. And that's where we either don't have evidence, or we actually have evidence that it hasn't worked in many cases. Now, one thing that you hear about today have worked pretty well. Vouchers, there's a good evidence base for vouchers. The problem is they've been run for the last 20 or 30 years as a kind of perpetual pilot. Only a small proportion of the people who could benefit from this effective intervention get access to the money, to the voucher. So, when you look at the broad picture of the law, you either have things that were implemented and didn't work, or things that were never properly implemented, but might work if we did more. And that's the kind of understanding we've been trying to get in our project. Now, especially at a time like now, when people potentially are willing to look up and say, wait a minute, let's look at the big picture. No more of this incrementalism, no more of helping some of the people. Where do we want to get? And when we thought about that and thought about what we want our system to produce, we sort of coined this phrase, health, equity, and housing, that tries to combine a number of different ideas in one package. Health and housing are so closely linked that it's important to have health there. Right? And health means that the house is safe, the individual premises is safe, that you can live there and not get sick from it. But there's also social elements. It's got to be stable. It's not healthy to live in a house for a month and then go to another house and another house, changing neighborhoods, changing schools. Housing stability is part of what allows a family to grow and stabilize its assets. And of course, it's got to be affordable. I don't have to say anything more about that. But all that is not enough if we don't think of the neighborhood too. People do better in neighborhoods where they feel valued, where they feel supported, and where there's opportunity and good transportation and safe. They're not exposed to toxins or violence, where there are actually things that support health, like parks and places where kids can play. There are many examples in our history of racially and ethnically concentrated, segregated neighborhoods that were healthy. So I don't want to suggest otherwise. But I think as we looked at the data and looked at our country, we thought sort of, if we're just thinking of what we'd like to get to, separate is often, if not usually, inherently unequal. And that what our country needs, not just for health, but for the kind of healing we have to have and for the kind of growth and opportunity and solidarity that we need, we don't want neighborhoods where people are divided by race or class. Islands of prosperity are just as bad as islands of poverty. We got to stop being islands. So we had this vision. That's sort of how we thought about the idea of what health, equity, and housing meant. It meant health and equity and housing all supporting each other. We think it's important when you're thinking about systems change. And when we think about housing, we're talking about a very complicated system. We think it's important to have an idea like health, equity, and housing. In part, systems change requires a motive. It requires a rallying cry. It requires some broader idea of what we'd like the world to be that lots of different independent organizations and actors, people who are not working together, literally, but who are more broadly part of the same movement, and who are trying to do many different kinds of things, can all look to for guidance to help them get towards the same place. So when we talk about law particularly, as you'll see, there's lots of different kinds of law here that's used in lots of different kinds of places and by different kinds of people. And part of health, equity, and housing as a motive is that those people, although they may never communicate, are still trying to get to the same end. But we also need a measure. And this is where, research has been really important, and our findings about the lack of evidence of the effectiveness of law has been important. If you do not measure what you're doing, then you don't know you're failing, and you don't know why you're failing. And when you let that go on for decades, when people are working and working and working and using the law and doing things, and yet the situation doesn't improve, that's usually a sign that we have a measurement problem, because the fact that we're standing in the same place is not becoming public knowledge. It's not becoming part of the conversation. Therefore, we're not able to get more radical change. We just assume it's going okay, going as well as it could. And finally, the idea of linking health equity and housing tries to work for us as a kind of method, an approach to being more strategic about what the law can do. So in our work, which we will talk about in the next couple of webinars, we offer this model of legal levers for health equity. And the idea here is that if we want to get more people living in good, safe housing, in neighborhoods of opportunity where we have diversity of all kinds, there are some basic domains that we have to make progress in. We clearly have to have fair housing in a broad sense. We have to do things to break down racial and economic segregation. There's a lot of legal levers that can do that. We need to take the existing housing stock we have and protect it, make sure that it's affordable, stable, and safe. And there's a lot of law that does that. We need to increase the supply of new and affordable housing, and law has a role to play there. And finally, and I think this is an important, often neglected one, is that you have to deal with economic choice and agency among poorer people. No matter how low you make the rent, there are going to be people who still don't have enough money to pay it. No matter how much you make mortgages available, there'll be people who can't raise the down payment. You have to think about the fact that we have too many people who work hard and can't get ahead. So let's think about examples. When you're talking about maintaining existing housing, we have ideas for better housing code enforcement. That's a problem in a lot of cities. And it can keep housing in the mix. When you think about enhancing economic choice for the poor, there's a lot of ideas, a lot of which have to do with stop not just putting more money in the pockets of poor people, but stopping taking so much money out of their pockets. We have cities, as we saw from Ferguson, but Ferguson is not unique, that basically run the city government on fines and court fees. That's not necessary. We don't have to do that. We don't have to hurt people's lives and pull them backwards like that. We'll hear about the Oak Park story. Affirmatively furthering fair housing is not just a particular law. It's not just a particular rule in the law that we need to get back into action. It's a way of life. And I think we learn about that from the Oak Park story. There are levers that you can pull to build the kind of community that promotes health and health equity. If we think about new housing, one of the biggest things we can talk about, but there are many again, is zoning reform. We have too many barriers that stop affordable housing from being built in neighborhoods of opportunities. And, it's time that we as I saw somebody say today, it's not enough to take a day off in your white suburban neighborhood to read about Black Lives Matter. You have to actually see what you can do and stop opposing getting actual Black people in your actual neighborhood. So our project, and I urge people who are interested to go and look at our full series of reports, comes from a systems perspective. And that means that we don't think that there's any one legal lever that can solve our problems. And in fact, there's a lot of balancing that has to go on. So when we talk about legal levers, we're thinking of the levers on a soundboard in a sound studio. And if you ever watch that process, you're adding bass, you're adding treble, you're taking off a little of this, you're putting on a little bit more of that. We have to think about the housing process as something that everybody across all sorts of legal domains are working on, and figure out how we can do the kinds of work that you'll see described in Oak Park, where these people come together and they use their different tools to make that beautiful sound of health equity. In later parts of this series, we'll talk more about that process of working together which we think of in terms of policy experimentation. You probably have heard that phrase that cities or states are the laboratories of democracy. And there's been lots and lots of discussion over the years of how you do policy in a more experimental learning fashion. And we think housing is a great example of a domain in which that would be a really good idea. So you can go look at the full set of reports that we have and tune into later webinars in this series here at our website. And I encourage you to do so. You can contact us. People on our team will be happy to talk about what we've done and more. And mostly now I'm happy to turn this over to people who are actually out in the world showing how we can use these legal levers to make real change. So thank you very much.
Great, thank you, Scott. Next, it is my pleasure to introduce Demetria McCain, who is president of the Inclusive Communities Project, or ICP. ICP's Voices for Opportunity initiative provides advocacy training for low-income renters and neighborhood groups fighting for fair housing and neighborhood equity. And today she's going to help us explore housing mobility and health equity. Demetria?
Hi, first of all, thank you for having me here. It's always good to talk to folks who get it. So I appreciate that. So I think my task here is to kind of give more of a local, practical, tangible context. But first, let me just say that the Inclusive Communities Project is a Dallas-based affordable fair housing organization, civil rights organization. We do both advocacy work and direct services work, and you'll hear more about our direct services through our housing mobility program that we do. But we are charged with creating and maintaining racially and economically inclusive communities throughout the Dallas region, as well as expanding affordable and fair housing opportunities for low-income families, as well as seeking redress for some of the harmful things done through the perpetuation of segregation and discrimination. So that's kind of who we are. We take a neighborhood equity and options approach to our work, meaning we focus on that third piece of our mission I explained, which is kind of goes to the neighborhood equity stuff that we deal with and see, and then making sure that people have options to move where they would like. So in fact, neighborhood equity remains elusive in Dallas. On the far left, you'll see a map that's probably similar to a map that you've seen before if you live in one of our major cities. This is the old 1937 red line map, and here you see how the city of Dallas was broken down in 1937. Red meaning the places that did not get the opportunity to get the resources, people didn't get the funding they needed to buy homes, and those neighborhoods are really kind of labeled as don't go there type of areas when it came to resources way back from 1937. I'll show you some maps a little later, and you'll see some similar patterns. But the green being, yeah, go there, those are great areas. The red and yellow, not so much. The blue, not as much as the green. But let's fast forward to that middle picture, which was taken in 2020 or 2019. This is what Dallas now knows as Shingle Mountain. In fact, this is in a residential neighborhood. This is a piece of land in the city of Dallas that was allowed to have this type of activity right next door to a residential area, right next door to where people live. And this, as was mentioned earlier, I think by Scott, that he mentioned zoning, but I tell you, zoning on the flip side, not inclusionary zoning, but more so industrial zoning, are the kind of problems that we see in historically redlined neighborhoods. And just to the right of that is not an actual picture from Dallas, but does represent a concrete batch plant, of which we have too many in some of our historically redlined types of neighborhoods. In Dallas, those neighborhoods tend to be in the southern part of Dallas. ICP, along with Downwinders at Risk and a group of fearless residents called Southern Sector Rising, are trying to fight some of these issues on a zoning level, because it really is a housing issue. It really is a residential neighborhood type of issue as it relates to places that have been really put upon. Scott mentioned lead poisoning as being horrible. Air pollution is horrible. Air poisoning, you might say. Right now, we're dealing with the I can't breathe issue because of the acts of police brutality and police misconduct. But in southern parts of Dallas, they are closest to the ground zero of where they can't breathe and they have impacts of asthma because what is going on where they live. Dr. Robert Bullard, if you don't know him, he's the father of the environmental justice movement. He teaches at Texas Southern University. He said that if you are physically located on the other side of the tracks, you will receive less of the good stuff and more than your fair share of the bad stuff. And so that really is the issue of what we're dealing with in the Dallas area. So our direct services work with housing choice voucher holders. What you see here is a map of the concentration of housing choice vouchers dated in 2018. If we go back prior to the existence of ICP, which we came on board in 2005, it will be even gross. You'll see even more gross of a concentration. And the overlay here is from the US Treasury Department, the Community Development Financial Institute's Distress Index. So in fact, this is an index put together by the federal government, but yet you see that people who use the federal subsidy called the housing choice voucher are located in some of the places that have the highest distress. Again, similar type of map. This one is done by, this is the Child Opportunity Index. Some of you may be familiar with the Diversity Data Kids team who created the Child Opportunity Index. We see the same pattern again. And if you recall the first slide I showed you with the red line map, the red parts were in the southern part of the city of Dallas. And so we're still tracking some of the vestiges of the 1937 and even perhaps earlier than that. And more recently, we've been paying attention to the CDC's Social Vulnerability Index. It's very important for us at ICP, based on what we see, and I'm sure other parts of the country, that we understand that neighborhoods of color, neighborhoods where Black and brown families live, Black and brown children live, are the most put upon. But even when you look at people who are below a certain income, for instance, white voucher holders versus Black and Hispanic voucher holders, white voucher holders are not living in areas with as much risk to hazards and disease and death as Black vouchers holders are. So it's important for us that it's not just a poverty issue, it's also a race issue, and you can't separate those two. But I invite you all to check out the Daniel Bishara's website, they've looked at this social vulnerability index, and with COVID-19, we can track some of the same neighborhoods that have kind of borne the brunt of COVID-19 as it relates to Black populations who are suffering at astounding rates. So in our work, it's about inclusion. It's not just about diversity. Inclusion meaning everybody gets to enjoy a piece of the pie because everybody has put in work for the piece of the pie. This is not a bootstrap kind of mentality. We are a region. We may have the city of Dallas, we have the county of Dallas, but we're a region of several counties, and people and their ancestors have put in labor for this region to be what it is. And so we should all be able to be included in enjoying the fruit of what the region has to offer. So we try to help people get to the other side of the tracks, if that's what they're choosing to do, as Dr. Bullard mentioned. But gaining access is not easy at all. You can tell a family, a low-income family, yeah, you're allowed to go to this neighborhood, but getting there is a whole nother story. And so our mobility assistance program is our housing mobility counseling program that helps families who are looking at moving to those other side of the tracks, proverbial other side of the tracks. If they're looking for neighborhoods or census tracts where there is 10% or less poverty, individual poverty, 80% or more of the people are that's the AMI, I don't want to assume people know these acronyms. Sometimes I can get to the housing tech soup. Area median income, where the area median income is 80% or better, and where the schools are actually passing based on state standards. If they're wanting to move to those type of areas, they can get the help of our counselors that we have on staff. And our counselors provide the counseling. They tell them about their fair housing rights. They tell them about what these various communities in our 7-county area have to offer. They help them find empty and available units. They help recruit landlords. They negotiate with landlords who know nothing about the voucher program and might want to try it out for the first time. And they sometimes are a liaison between the housing authority who administers the voucher and the voucher holder. And after the families move, our counselors are still available to help them if issues come up. Just so people understand what the voucher is, a person pays 30% of their income towards the rent, and the rest is paid by the voucher. The rest is subsidized by the voucher. But there are lots of barriers to families being able to make these kind of moves. And this slide just kind of tells you all the various levels where you may find barriers. You can find it in misinformation. Perhaps the housing authority is not even telling the voucher holders all the various cities and communities to which they may move. There are barriers through the private industry. Maybe there's tenant selection criteria that don't quite make sense or that keep some people out, right? So if you're saying that, I'm a landlord, and if you have any kind of misdemeanor on your criminal record, then I won't take you. Well, maybe that person did write a bad check or a few bad checks 20 years ago, right? What's going on there with the tenant selection criteria? Is it having a disparate impact on a certain group of people? Obviously, there's the local, state, and federal level kind of barriers, from a local level when they're creating affordable housing programs. If your city or town is, what's the income targeting, right? Affordable housing is a general term, but is it affordable for people who make 80% of area median income, 40% area median income, 60% area median income? Those are the kind of things that can create a barrier because you're not reaching the people who's the person who may be the barista or the healthcare aide if your local program for affordable housing is targeting people at 60, 70, or 80% of area median income. State level, right? Do you have policies at the state level that might be promoting what I call race-based NIMBYism, meaning not in my backyard? Don't build that low-income housing in my backyard because I know the type of people who are going to live there. On the federal level, do you have programs that are steering people to the traditionally, historically redlined neighborhoods, segregated neighborhoods? So those are tons of barriers. And that's really what our advocacy work tries to address. And so let me just give you an example of how we've been trying to address this kind of stuff. So we do research. For instance, we surveyed about 2,000 private landlords in our Dallas region, and 12% said, yes, we will take voucher holders, right? And when you broke that down by zip codes, where zip codes were predominantly Black zip codes versus predominantly white zip codes, the percentages were obviously very skewed. 4% in predominantly white zip codes said they would take voucher holders. So that gives you some sense of some of the type of research that we do on a local level. Policy advocacy work to address some of those barriers. Right now in the state of Texas, it is illegal, according to state law, for a city to even try to pass an anti-voucher discrimination ordinance, which also known as source of income, right? Which are all over the United States in various cities and various states. But the state of Texas on the state level has sought to preempt that. And that's because of the pushback from industry. So that's like kind of, you're marrying the barrier of government and you're marrying the barrier of the private industry coming together, creating barriers. And so that's something that we've had to deal with here, and we continue to deal with that on a policy level. Engagement, quite often some developer might want to build low-income housing in a higher income type of neighborhood, not fancy schmancy rich people, that's not what I'm talking about, but a higher end type of neighborhood, a neighborhood that has never been redlined, let's say. And then we have to go out to those public meetings, and you've got entire throngs of HOA members in the audience saying no, no, no. A sea usually of white people who are middle income saying no, no, no. And that's something that we have to contend with. As far as program administration, because of the problem of voucher discrimination, we took it upon ourselves to create a sublease program where we actually rent a unit from a landlord and then sublease, legally that is, sublease it to a voucher holder. That's one approach that we've taken, and it's an approach that needs to be taken to scale. We kind of just did that on a demonstration level for our sake, but it's a type of thing that can be taken to another level if supported publicly with philanthropy or governmental entities. Advocacy training of residents, you heard about that a little bit in our bio. We try to train residents so that they can fight back on their own and go to these public hearings and be in the public square on the issues that are important to them, and try to get different laws passed that support their interest. And there's the credible threat of litigation. Sometimes we do litigate, but sometimes we don't have to. The town of Addison, which is just north of the city of Dallas, actually had on their books something that said that, regarding a deed restriction, saying that particular developers could not lease to voucher holders. Well, fortunately, we are represented by Daniel and Bashara law firm, and they wrote a letter on our behalf saying, hey, this has a fair housing impact. What's up with this? And my colloquial way of saying it. They didn't say it like that way. And so, in fact, the city attorney took a look at it, and they took a look at it in the town of Addison, and they reversed that. And so now, actually, there are some voucher holders through our sublease program living in Addison, and hopefully there'll be more in the future. And Addison is a place that has lots of multifamily housing. So it's not even a place with just single family housing. And so then, of course, there's litigation, which is always the last resort. Our litigation against HUD several years ago brought about, I will try not to be too technical here, raise the level of subsidy that voucher holders could get so that they could afford to reach some of the more expensive apartment units and rental units throughout the Dallas region. And federal government through HUD has kind of taken that other places throughout the country as well, even though it started here out of litigation. That case settled. Our tax credit case against the state housing agency, that case has yielded some policy changes on the state level as far as where low-income housing can be built. So these are the approaches we take, and we try to deal with all kinds of legal levers. So I think that's my time, and I welcome any questions you may have later. Thank you.
Great. Thank you so much, Demetria. I'm sure the questions are rolling in here. And finally, it is my privilege to welcome Athena Williams, who is Executive Director of the Oak Park Regional Housing Center. And she is going to share a little bit about how they promote fair housing rights and equal racial access in Oak Park, Illinois, and surrounding communities. Athena?
Thank you. Thank you so much. Thank you, Scott. Thank you, Demetria. Thank you. So yes, I am the Executive Director. I am new to this role. However, I've been in the agency for the past 5 years, and I'm going to share with you the Oak Park strategy as to how we have, over almost 50 years now, it'll be 50 years in 2022, how we have successfully promoted and how we're currently working to sustain diverse and integrated communities. So Oak Park Regional Housing Center, as I stated, we have been working this mission for almost 50 years, and we cannot do it alone. We've been working with the government of Oak Park. We've also worked with the Oak Park residents, and we work with community leaders to make sure that we provide the structure that creates an open and welcoming community. And we do that through the affirmative furthering fair housing that Scott mentioned earlier, so that we can support all people coming into Oak Park. And I'll share a little bit with you the history of how this began. So Oak Park is cuddled between the city of Chicago to the east and the Austin community. And then to the west of Oak Park are a couple of neighboring communities, which are Forest Park, River Forest, and Proviso Township. Oak Park has a different median income, a higher median income than all of those communities, which fluctuates the impact of how residents live in those communities. So during the 1968, during the aftermath of the assassination of Dr. Martin Luther King, you saw a lot of white flight from the Austin community. You saw a lot of white flight from the Maywood community, but Oak Park took a stance that the community, which was at that time over 90% white, was not going to leave. They were going to stay, they were going to welcome others in, and they were going to make sure that the community was welcome to all. During this conversation, you're going to hear me refer to different words here, and that's why I have this slide, so that everybody know that there's a difference between diversity, integration, inclusion, and equity. So throughout the conversation, you'll hear me refer to these different terms. I would also like to add to this list intentional, because a lot of the work that we're doing here in Oak Park is intentional. And in order to achieve a lot of the successes with integration and the successes for healthier communities, the work has to be intentional. So first, we'll talk about a little bit about segregation and the inequalities in the communities, especially those communities that surround Oak Park. So we have to realize that segregation is truly the root of inequality and the root of inequities and it plays a huge role regional and locally. And in order to overcome this, we have to look at segregation for what it is. So as stated here in the slide, segregation provides the impetus for continued discrimination. Segregation correlates with inequities in jobs, and as we're stating here, health disparities. And segregation is huge as far as disadvantages socially and economically. So this is a slide, this is a broad view of the racial and ethnic change that occurred in the city of Chicago during the 2000s. So if you see the legend to the right, the pink dots represent the white population, the blue, the black population, the green, Asian, and the orange, the Latino population. So this is a, like I said, a broad stroke of the Chicago community, and the black outlines are the different communities within Chicago. So this is an up close look as what I stated earlier with Oak Park in the middle and all the surrounding communities. And if you refer back to that legend where white represented the pink dot and black represented the blue dot, you'll see that compared to all the other communities around, Oak Park has a more integrated pattern code color than the rest of the communities around. So with Oak Park Regional Housing Center, as we were a partner with the Village of Oak Park governance and the other community stakeholders through Oak Park, it was crucial that we came up with a way to make sure that Oak Park, in addition to its diversity, that we maintain integration within the communities. And Oak Park being 40% rental, meaning that we have over 5,000 rental units, it was at the time, and again, I'm going to say at the time, and I'll address that later, that we looked at renting and working with renters as a way to help renters not have to deal with some of the typical housing issues. So some of those typical housing issues are that renters would have to deal with if they were non-white would be stereotypes, discrimination because of their color, many different segregation issues. So through the housing center, we were able to help renters not have to deal with those issues. So the way that we actually do that through the Oak Park Regional Housing Center strategy, we are what we call disruptors with biases and misperceptions. A lot of that comes from the fact that we actually counsel our renters, potential renters, counsel them about their fair housing rights, and at the same time, we counsel the landlords about how to become a more open and welcoming landlord. And in addition, the village actually works with our agency to work with landlords to make sure that their housing stock is more appealing and more healthy. So that way a person of color wouldn't be able to come in and just end up in one of the units or end up in a unit that's not well taken care of. That's where the partnership comes in with the village. In addition to that, it also helps to expand people's housing choices. And that actually helps to promote the integration that you see here in Oak Park. So what I would like to share about that is, even though we have this strategy and this model, our integration still is reflective of the actual numbers in the region. So for example, you still have approximately 64% whites in Oak Park, just like you have 53% in the region, but we're still all integrated. So if you look at the numbers here, you will be able to tell the difference or see that there's not much difference as it reflects in the region. So this goes to show that we use the diversity and the integration to become opportunity and mobility for families that are seeking mobility in different areas. So therefore, diversity and integration turns into an asset, which is truly a simple equation for remembering that diversity with integration results to opportunity. So even though, as I stated earlier, even though we have, I don't want to say achieved, but even though we have acquired this asset of having an integrated and diverse community, we are still moving towards developing more inclusive communities. So as Demetria stated earlier, it's really important that there's inclusion where we all work together to have social interaction among all racial groups. And once we achieve inclusion, which will help with the sustainability for integration, then we can move towards making sure that there are equalized outcomes for all groups. And so as you see here, integration is the heart of OPARC. It serves as a core value that reinforces the spirit here in the community. We promote a one village, one community. We provide aspiration for common causes, and we work really hard, especially during the civil unrest that's going on in the nation right now. We're working really hard to come together to really stand up to our core values in the community. And with that said, the OPARC Regional Housing Center, we work to continue to portray OPARC as a welcoming community to attract new residents and to nationally highlight the brand that the Village of OPARC is. If you have any questions, that's how you can contact me, and thank you.
Thank you, Athena, and thank you to all of our panelists for helping all of us to feel so inspired and ready to take action in our own communities. We have some time available now to have some discussion with our panelists. So we have a few questions in the queue, but if you have a question or a comment, please feel free to enter them into the chat or question and answer boxes on the right side of your screen, and you will try to get through those today. So to start us off here, Demetria, we have a question about whether the voucher discrimination survey report and some of the other materials and initiatives that you spoke about, is that information readily available online if folks want to learn more?
Yes, I think my last slide had our blog page. That report about the landlord survey is definitely on our blog page for sure, as well as some of the actions that we tried to take in 2019 on the state level to deal with the issue of preemption, where the state has blocked cities and counties from being able to pass source of income discrimination ordinance. So just go to our website, inclusivecommunities.net, and then go to our blog page once you get there.
Terrific. We'll make sure that we include that link when we send out the link for the recording of today's webinar. We had a couple questions come in about whether we can share the slides also, and we'll make the slides available to folks too. So if there were links that you wanted to be able to follow, that you can do that as well. Demetria, while you have the floor, we also had a question about how you mentioned post-move support as one of the functions that your organization provides. Can you say more about what types of problems come up post-move and what type of support you're able to provide?
Sure. Some of it is stuff we do on the front end, which is making certain that the families know, for instance, how to enroll, what it takes to enroll in their new school districts, because quite often our families are trying to change from the Dallas Independent School District to another school district. So those are loops, not just into different schools, but into different school districts. If there's an issue that happens to come up between the tenant and the landlord, our counselors are usually there to be able to negotiate and hash out some of those issues. If the family has an issue, let's say in the neighborhood, our clients can contact a counselor to deal with that kind of issue. For instance, once I remember, this was quite some time ago, and no issue is really the same, honestly. Because we're talking about several cities throughout a 7-county area where our families moved. But one school district didn't believe that the family lived in the school zone and came to their home to double check that and found out they actually did live there in a single family house, because voucher holders can rent houses. So that's an issue where one of our counselors got involved to make sure that everything was taken care of and that there were no issues. But things like that, if a family has a meeting at the school, then sometimes a counselor can go to the school with the family, making sure that there are resources available. So if a school says, okay, this kid wants to be a cheerleader and their cheerleader fees, making sure that the school recognizes that the kids in the school who need that information about how to get some of those resources paid for regarding extracurricular activities and things of that nature. It runs the gamut, honestly.
Thank you. That's really helpful. We have another question I think that any of the panelists might be able to answer, that is about, do you have any advice or comment for nonprofits that work on building or rehabilitating housing around the U.S.? What can our role in this be, or what is our role, or what can it be?
Can you say that again, please?
Sure, absolutely. Yeah, so the question is, do you have any advice or comment for nonprofits that work on building or rehabilitating housing around the U.S.? What is our role in this, or what can our role be?
So, go ahead, Scott.
Well, I'll just point to some of our work looking at the low-income housing tax credit. and efforts there to use the QAP to favor housing that's moving people into neighborhoods of opportunity, not historically redlined. Supporting that, being an active supporter of that is something. And I think generally trying to work with, I think taking a strong role with political leaders in your community to get them to help you break down the barriers to building more houses and units in places where you haven't been able to build before I think something that would be really helpful, because your voices really matter there.
So what I was going to add is, if you recall when I was presenting that I used the word intentional. So everything we do has to be intentional if we want to achieve certain factors such as integration. And because we know it's the integration that helps the communities to thrive. And if I were the actual property owner, if you have the ability to make a difference, then I would suggest that you would try to make sure that one building is not one particular race, that there's a great racial mix up in that particular building. And not just a racial mix, but a racial and economic mix in the building.
Great, thank you. I see that we have a few more questions coming in. I'm going to just do one more before we conclude today. Athena, this question is for you. If somebody is interested in building off of Oak Park's successful counseling model, do you have any advice for them about what steps they should be taking first, if that's something that they want to get started in their own community?
Okay, I'm sorry, I missed the question. Can you tell me again?
Sure. The question was if somebody was interested in replicating or building off of Oak Park's successful counseling model, do you have any advice about how they would even go about getting started with that? What steps they might take first?
Yeah, we actually have a couple of groups right now that's interested in that. And one of the problems that we're running into is that even though our model has been successful, it's really difficult to find funding to implement it. And so with the couple of groups that we have that are interested now, we're actually looking at how we can write grants together to be able to implement this project in other areas. And maybe the more people that can work on it, the better.
That's terrific. Very exciting.
And so feel free to, my contact information is, I'm sorry.
No, you go ahead.
I was just going to say my contact information is on the last slide, so just feel free to reach out to me and I can give you more information about the other groups, and maybe we can have our own panel discussion and figure out a way to collectively bring more people across the nation together to say, hey, this is a model that's working. Let's try to implement it in other areas.
Terrific. That's really exciting. And I can see that we could continue the discussion, but we're at the top of the hour here. So I just want to take a few minutes here to have some closing remarks. I want to encourage all of you to attend the other webinars in this series. We'll provide more information when we send out the recording link, but also to stay engaged in the conversation around housing. And I would like to turn it over to my colleagues at the National Low Income Housing Coalition and one of our other staff members here at NCHH to tell you about how you can get connected and stay engaged. So Mike?
Sure, thanks. Yeah, so my name's Mike Kaprowski. I work at the National Low Income Housing Coalition. We're obviously very glad to have co-sponsored this webinar because it's so important for us to raise awareness about housing and segregation and just how it fundamentally shapes nearly every aspect of life. So what I do at the coalition is I lead the Opportunity Starts at Home campaign. We are really focused on engaging Congress. So we focus on federal housing policy matters. Obviously, Congress is going to have to do much more to address the housing crisis. And the idea behind Opportunity Starts at Home is that it's not just housing advocates that need to talk to Congress about this. We need advocates from healthcare and education and civil rights and food security and criminal justice and environmental protection, anti-poverty folks to talk to Congress about why housing matters to them. Because you could draw a line from housing to all of those sectors that I just mentioned. So the idea is that we bring together all of these sectors to engage Congress. We've brought together groups like the National Education Association, the biggest teachers union, the Food Research and Action Center, the Natural Resources Defense Council, Catholic Charities USA, the NAACP, groups where their bread and butter issue might not specifically be housing, but they understand how housing shapes outcomes in their respective fields, and they're ready to engage on federal housing policy. So we have about 100 national groups that are involved in the campaign. We also have some state-based campaigns. So I'd really urge you to go to our website to learn more. You can see it at the top right of your screen. It's opportunityhome.org. There's lots of different ways to get involved, and so I would encourage you to look at that. If you have any specific questions, you can email me. You can also follow us on Twitter. Our Twitter handle's up on the top right as well. So, you know, the spirit of this is intersectionality and multi-sector. So that is exactly what we're trying to do with this campaign, and bring that spirit to the halls of Congress. So thanks.
Thanks, Mike. And my name is Sarah Goodwin, and I coordinate the National Safe and Healthy Housing Coalition, which is a broad voluntary coalition of over 600 members from 400 organizations across the country. It's run by a 15-member steering committee, and coalition activities include monthly action alerts, webinars on healthy housing topics, and then opportunities for advocacy, which include sign-on letters for appropriation asks for healthy housing programs every year, as well as opportunities to meet with members of Congress, both in your home districts and in Washington. So if you're interested in any of that, the sign-on link is here on the screen, and my email is as well. So thanks.
Great. Well, I want to thank you both, and thank you again to all of our panelists and to all of you for attending today, and to our co-hosts for today's webinar and the webinar series. We look forward to seeing all of you at our next webinar, and hope that you have a great rest of your week.